Good morning, good afternoon, and good evening, public safety. I am Jason Karp, Esquire, here with my good friend Theodore Jerome Kennedy, otherwise known as TJ. TJ, how are you?
I'm doing great, Jason. How are you?
Doing great, doing great. We've got a lot of news going on in the world of public safety, so let's get to it. So as you all know, we generally start with some kind of COVID update. And right now, as we've all been going through this craziness, in our last episode, we talked about how all 50 states now are easing the restrictions on stay-at-home orders. But the concept of social distancing remains and has been something that people have been living through now for several months. And there are some real unintended consequences of this that are not specifically or directly COVID related, but indirectly related, that folks are experiencing with the stay-at-home orders and isolation. And our first responders have to be aware of this, because as they're going out and making calls, they're going to be facing, new types of challenges with folks. They may get a call for a broken bone or some type of injury, but then have to face some other consequence as a result of the social distancing and the isolation. So there's been a kind of recent study, and I'll just go through a couple of the items, but and then we'll get your take on this, TJ. But so first and foremost is decline in mental health. And I have no idea what they're talking about, because my mental health is perfect, as everybody knows. But although I have seen it in TJ, but his mental health was declining way before COVID ever hit. But seriously, obviously, social distancing, isolation has an impact on mental health. There's been a rise in substance abuse. And isolation, staying at home, reliance on drugs, on alcohol, certainly understandable in many cases. I know that I have a regular cocktail hour myself these days, a little bit more often possibly than I used to. Don't tell my wife, but it's a real issue. On a more somber note, some spike in domestic violence, and we've mentioned there's been more activities with gun accidents and violence in the home, and then just kind of what we'll call the frequent flyers, right? The overutilization of the EMS system, and apparently now with the stay-at-home orders, there's been even more uptick in folks calling EMS, not necessarily just because things are wrong, but because they want the social interaction. It's kind of crazy. And I don't mean that in a literal sense.
All right, so first of all, I won't criticize the fact that you drug on our public safety network happy hour for an hour and a half last night and went a little longer than usual, but I guess the crowd might already understand.
Listen, if people had to work with you like I do, they would understand. You know what I'm saying?
All right, I get it. So to talk seriously, I think there's a number of things that are changing on the kinds of calls that fire and EMS and our first responders, law enforcement are seeing during COVID. One is obviously the massive amount of personal protective equipment changes the interaction. Wearing a mask, wearing appropriate clothing, wearing appropriate gloves, disinfecting changes the stress level and the physicality to some degree of even the folks who are doing that each and every day. I think we're seeing an uptick with people calling 911 too late or way too into an incident related to a stroke or a heart attack. And I think that's showing a big impact when it comes to survivability. Cardiac arrest survivability is way down in a number of the small studies that have been started so far. I'm hearing from some ER physicians that their patients that are coming in are just much more sick than they normally are because they waited a long time to either call 911 or to be driven to a hospital. That's not good when we talk about things like heart attacks, where if you can get access to a cath lab from that ER quickly, you can often solve most of the initial damage that is happening during a heart attack. Or for a stroke, where there are thrombolytics and other interventions that can happen in a stroke center for that stroke that prevent a lot of the long-term damage. the biggest recommendation for everybody out there is if you're having any of these life-threatening conditions, you call 911 or whatever the number is in your country, and you be transported by paramedics and professionals in the EMS field to take care of you, just like you always would before. That shouldn't be any different. And we need to do that because it's affecting the outcomes of people's health. So that's the biggest issue, I think. The second one, I think, is, there are some areas of crime. Some of the violent crime in some cities has gone up or not gone down, as some people may have thought. In other areas, a lot of the petty crime, a lot of the robberies or thefts that happen due to large crowds has gone down because there aren't as many large crowds or events happening as there normally are. We're seeing, things related to domestic violence. Typically, the numbers are up right now. So these have an impact on our first responders across the board, but also on our citizens. And I think the biggest thing I would recommend is for those that have true medical emergencies, they need to contact emergency services and be transported like they normally would, and not to wait longer because of the pandemic and think that you don't want to access that healthcare in our healthcare system. It's there for you and is there for that reason.
Yeah, let me pull on that on two different areas. One is, bringing in kind of the technology aspect of this and giving that, the circumstances when, EMS or any first responder shows up at a home, maybe a little bit more uncertain today than they had been before. And what does that say for use of, remote communication, telemedicine, the ability to maybe see into the situation or understand it remotely before actually arriving at the scene? Is this something that, folks should be thinking about or considering, kind of given this new normal?
I think the new normal is that technology is part of our everyday life when it comes to emergency response. We're seeing a lot more next generation 911 being implemented. We're seeing a lot more video triage being done where folks can actually have a video chat with either a dispatcher or a paramedic to be interviewed on what is going on first, in many cases on some COVID patients, for example, whether they would be better to stay at home or be transported. And then we're seeing on the healthcare side, a tremendous amount of telemedicine being done for mental health and physical health and for everyday things that would have maybe brought somebody to a hospital for a minor element that can be dealt with a telemedicine visit, or to look at a particular issue that somebody's having that can be done by video and a video chat. So huge explosion in the use of technology for telemedicine. Very big explosion for both ambulances and emergency medical services, leveraging telemedicine and two-way video for paramedics and emergency medical technicians, and also for dispatch centers to use it as a better way to triage calls. I was on a webinar this week with Mel Meyer, who's from the Oakland County Sheriff's Office in Michigan, and he was talking about how they've leveraged video and two-way video to help triage with their dispatch center for a very large area and a very large population, and it has helped them create better utilization of public safety services by having that insight. So technology is changing for the better in our public safety answering points. It's changing for the better with our emergency medical services and also with our healthcare interactions.
Yeah, and given these uncertain times, it really has two impacts. One is not only helping with potentially more favorable patient outcomes, but it also keeps our first responders safe, keeps both parties safe, and, initially while we're still in kind of this distancing, environment. So it's absolutely a huge need to start leveraging more and more, I think, the technology available to these first responders. And the last point, I wanted to get your thoughts on that. What about training? And we know that, EMTs, paramedics, others are have gone through extensive training and dealing with, many, many different issues. But now we're kind of faced with some new ones with, some of the mental illness and other things that are derived from social isolation. Do you see a need for additional training, that's kind of brought on by now the experience with the pandemic?
I think continuing medical education is critical for all healthcare providers and first responders. And I think that probably one of the unique things that happened at the beginning of this pandemic is a lot of canceled training and canceled travel to conferences and other things for obvious reasons. But I do believe that across the board, we need to make sure that all of that continuing education for pre-hospital medical response and so forth is still happening, whether it's happening by video or it's happening by on-site classes that are part of that fire station or that EMS response. But I think video is going to become a bigger tool for continuing medical education during these times of pandemic and some of the social distancing. And it needs to still happen with new subjects like some of the things we've talked about, better use of telemedicine, dealing with some of the mental health issues that they're seeing that are unique right now. And this has to happen by leveraging video.
Yeah, great insights as always. Um, Speaking of unintended consequences of the pandemic, a rise in the number of crimes where criminals are using surgical masks. And, this is, I guess, obvious in retrospect, but, historically, when criminals would rob, a convenience store and they had a face mask or something over their face, it became a telltale sign that something wasn't right. Well, nowadays we're all wearing masks. And so what used to be the exceptional is now the ordinary. And when you think about it, and you think about some of the particular questions, I mean, not only has it become much more difficult to police against who might be a potential criminal or threat in a given situation, but masks and there's certain telltale evidence signs that would lead to probable cause and would lead to suspicion historically no longer does, because I know I've got a cadre of masks sitting around in my house, and if someone searched it 2 years ago, they would think, what the heck is this guy doing? Today it's totally normal. So how do we manage that?
I don't think I have the answer for it. I mean, I think if you were to walk into a bank and be wearing a mask a year ago, people would become quite suspicious. But everybody who's walking into, let's say, a bank or a convenience store today is probably wearing a mask, and for appropriate reasons. So I do think it's giving criminals a little bit of a leg up on some of those traditional crimes where masks would help them get away. I also think technology is still quite good, though, in between tracking and video cameras and license plates and other descriptions. I still think they're going to get caught, so they shouldn't get too bold in what they're up to. I think that our law enforcement has come a very long way in being able to identify suspects and what's happening. And I think they may have a small advantage for a short period of time, but that will go away quickly.
Yeah, and it's just important to remain vigilant. I mean, whether you're a citizen, within a given area, make sure you're communicating, make sure that folks know you're not a threat, is always a good thing as well, right? I mean, we're still citizens, we're still human beings, we still need to communicate. And although it's very bizarre sometimes not to see someone's face, it is still very important to continue to communicate and to socialize in ways that so folks understand your intentions. So other things going on with the pandemic, unfortunately, unintended consequences, fire department funding. And there's, as various types of funding when you have your professional fire departments and you have state, county, city funding mechanisms, but really getting hit hard are a lot of the volunteer departments who rely on communities and community events to raise critical funds for their operations. And I know that there's several examples recently in Pennsylvania and other states where they've seen a significant drop off in the ability to raise money, which is having an impact on their ability to operate and upgrade equipment.
Yeah, I mean, it is a real impact. We have to remember that the largest number of firefighters in the U.S. and across a lot of places in the world are professional firefighters, but they act as volunteers. They're not paid for what they do. They volunteer their time. It's typically in their community. It typically impacts their work. It's just amazing the amount of training and the effort and the responses that they perform on a regular basis. And most communities that are small can't afford to necessarily have a career department with full-time firefighters. About 1 million just in the United States alone. Growing up in rural Pennsylvania, I was a volunteer firefighter in high school myself before I moved on to becoming a career firefighter. And these departments offer tremendous capabilities and responses in their community, and they're true professionals that need their equipment. They need the personal protective equipment. They need the appropriate apparatus. They need to do the appropriate training, and it has to be funded. And they fund these on bake sales. They fund these on doing bingo or other events. They fund these on renting out the fire hall for weddings or other funeral wakes, other things. And I've been to many family gatherings at different parts of life that have occurred at a firehouse. I've been to retirement parties of loved ones who have occurred at their local firehouse. That's the gathering place for most people in small town America, and it's a part of who we are. It's also a part of how they fund their emergency operations. And these donations are critical. If you can afford to give during this tough time, give to your local volunteer fire department. Be a part of that. Same thing for volunteer emergency medical services or search and rescue organizations. They all are having a very hard time by not having the normal events that fund their day-to-day operations. To this day, my mother supports her local Pennsylvania Fire Department auxiliary and actually does events like pancake breakfasts and bake sales and things like that to support that. Long after I don't live there anymore, I'm not a firefighter there anymore, but she still does that today. And I think that we need to understand that financial impact is real to all of these departments across the country.
Yeah, and as you know, here we are, Memorial Day and kind of traditional events that, you know, normally would take place. And oftentimes, you know, our public safety community and our fire community are very involved in those with a lot of their fundraisers and activities. So, I echo your sentiment. A message to the community at large is, please do contribute. These funds go directly to supporting necessary operations of these departments and protecting our communities. They are local dollars, they stay locally, and they're desperately needed. And the message to the fire agencies and the volunteer departments themselves is, one thing we've seen, and I'm sure a lot of folks are doing this, is, moving some of these fundraisers online, right? Some things that you can do in terms of online bingo and online games and sweepstakes and other fundraising activities. We're starting to see some level of success, and certainly I would encourage all who are in need to take advantage of, once again, technology and the internet and the ability to reach people. But it's a two-way street. We've got to remind folks that it's important to continue to support our local public safety and firefighters. It's really just critical.
Agreed.
So moving on to technology news. A recent survey, which was conducted by Zebra Technologies, about the importance and the need for new mobile and advanced technology in public safety. Some really interesting results. I think for you and I, TJ, this is expected and probably a very welcome sounds to our ears in terms of what we're hearing, but for sharing for everybody. And I know, there continues to be, different viewpoints on this. According to the study, 7 out of 10 public safety agencies see an urgent need to invest more quickly in mobile solutions and technological advancements to better serve communities. Is that surprising you at all?
Not surprising at all.
Yeah, I mean, we've talked about this on every show. This is what we do. We could go on for hours on this, but what's nice is to see the validation that public safety now, with access to more and more of these tools, are seeing how they influence their outcomes and influence their ability to be effective. According to the survey, mobile devices offer public safety agencies a strong performance edge to boost productivity. So it's not just about performing their job in terms of saving lives, which is a huge part of it, but also internal productivity and efficiency. Reduce costs and better engage the communities. Anything surprising there?
Not at all. I mean, we've known all along that technology used correctly can make our first responders more effective, more efficient, and even safer at what they do. And that often this newer, better technology is less expensive than some of the legacy technology.
100%. And there's just ways, as we just talked about, using the internet, using applications to connect with the community, have more transparency with the community. And, I know that we, have applications locally here that law enforcement uses to communicate with us, with our kind of neighborhood community social websites. And of course, Ring Technologies and how many of us have Ring doorbells or video doorbells where that information can be shared, voluntarily with local law enforcement. So a lot of great community outreach. The other thing really interesting, it says here 95% of agencies will deploy rugged tablets without keyboards. 90% will use rugged 2-in-1 tablets, and 95% will invest in rugged smartphones, as well as 91% will have mobile printers in the field. All over 90%, 9 out of 10 agencies are going to be using some ruggedized smart device and mobile printing in the field to improve effectiveness. Not much to say other than, bravo, right? I mean, that's where we should be. As TJ likes to say, I'll steal his line, there should be no public safety personnel in the field today without a smartphone, a tablet, or a smart device on their side at all times. Period. End of story. Drop them. Boom.
Stole it.
And finally, the one thing that was interesting, it does appear that ruggedness of the devices, which, you know, is logical, is an important part of the study. I mean, they want, public safety wants a rugged device that's going to, you know, work in the environments that they work in. They're going to be dropped. They're going to get, you know, liquids on them. They're going to be exposed to heat and different elements. So not surprising, but interesting. And again, notes to, you know, those who are bringing those services to market. It's important to ensure you're catering to this important marketplace when you're bringing these technological advancements, you know, forward and to our communities.
My fellow firefighters and first responders, they definitely are good at breaking things, and so they like things that are rugged, and so that doesn't surprise me.
So finally, to close out on this Memorial Day weekend, a interesting announcement by Fraternal Order of Police and AT&T FirstNet, where they're going to enter into a collaboration to talk a little bit more about FirstNet. DJ, you want to tell our listening audience a little bit about what's going on there? Yeah,
so the FOP, as many know, is the Fraternal Order of Police supporting our law enforcement professionals. And literally, this is an organization that's always ensuring that the actual police officers on the front line are getting the appropriate equipment that they need, that they have the appropriate tools to do their job effectively, and that they're safe in what they do every day. And the fact that they've teamed up with FirstNet makes perfect sense to me. Certainly, I think that law enforcement will be well served by being educated by the FOP and FirstNet working together, and also supporting a number of their initiatives that are about safety for law enforcement each and every day, and about educating them on technology and the tools. So terrific partnership between the FOP and FirstNet, and I think it will bear great fruit for technology for law enforcement because of the combined effort. Absolutely, well said. So with that, I want to thank everybody for watching on our special Memorial Day episode. I want to thank in particular our first responders and our military and veterans for all that they have done for our country and continue to do for our country. And as everyone is enjoying themselves and hopefully getting a little bit of fresh air during this Memorial Day weekend, please stay safe. Once again, I'm Jason Karp, Esquire, and this is my good friend TJ Kennedy signing off from PSN News of the Week.